Hey, Global CE Day, Tom Judd from CED here. I have the privilege of interviewing Riad Farah from Beirut, Lebanon. And Riad, one of our great collaborators who's made so many contributions to our field, both in the Eastern Med regional office region of WHO, but in the Middle East, North Africa, IMRO, MENA, as we call it, as well as around the world. So Riad, hey, the last couple months in Lebanon have been pretty tough. How are things going on for you and for clinical engineering there?
Well, Tom, thank you very much for having me, and I'm so excited. I'm so proud to be part of the big CE family in the whole world. Honestly speaking, we have devastating months. The last year was so terrible on us. Unfortunately, it started 1 year back with lots of riots and lots of problems. Um, Roads were blocked and everything. And then we had a big financial crisis. The banking system collapsed. We cannot use our money in the banks. And this reflected to our works because we weren't able to purchase spare parts. So the clinical engineers have to manage to repair expensive and sophisticated equipment without buying new spare parts. And it's a very tough thing to do. And after that, it was topped up by Corona, which I'm sure COVID-19 had changed the economy of the whole world. And after that, we unfortunately had this unfortunate experience, the explosion in Beirut. It was one of the biggest in the world. So many lives have been taken, so many dead people and wounded people. Our hospital was totally destroyed. And since August 4th, we are 16 clinical engineers. We were working 16 hours a day. Everything that you can mention, from garbage picker to building, to working on false ceilings, and then managing to put medical devices into safety, trying to fix equipment. We became expert in taking parts from several devices and put them in one device and making it functional, because this is the only way to survive. We had 4,000 medical devices at St. George Hospital, valued around maybe $40 million. And we had around 1,400 medical devices totally destroyed. So we were obliged to combine the proper operational, functional parts of several devices with the others. The good thing is that we tried to standardize the medical devices 10 years back. So we had, from the same brand, several devices. This helped us to be able to manage to make as much operational devices as much as possible.
So Riad, I know there's been tremendous courage. I mean, not only obviously in some of the videos you've shown among the nurses and many of the healthcare workers, but even your own team, you know, just picking up after a disaster, really.
Absolutely.
A lot of courage.
We had 2 colleagues, clinical engineers. They were wounded because of the projectile, if we can name them, or loose false ceilings. While working, things will fall, and then not all safety devices are available, like helmets and other things. So we had 2 wounded clinical engineers, but the challenges was not only with the, everybody was so enthusiastic. Everybody wanted to work. Everybody wants to stand up again. This is something that we learned, that we need to stand up again. We don't have other choice. And we have to, because the hospital beds are limited in Lebanon, and the COVID is picking up a big number of patients, and we have to stand up again and start servicing. We had lots of heroic heroes, let's say, nurses, doctors, biomedical engineers, even safety guys. Everybody was putting their lives at risk so that to be able to save patients. I personally went back after the explosion to the hospital, and it was totally destroyed. We stayed from 8 o'clock in the evening till 2 o'clock in the morning evacuating patients. And our main concern is to try to accommodate the life-saving devices for the patients at risk and evacuate them and transport them to the other hospital. It's feeling, I cannot really explain it in words. I don't wish anyone to pass through this bad experience, but luckily and fortunately, we had friends around us and we were able to stand up again.
So Riad, I know you and your fellow collaborator for CED, Bassam Tabshouri, have been working on clinical engineering in Lebanon for a long time. Tell us a little bit about that local society, because it's a springboard and a platform and a model for other societies in the region.
I've been working in the clinical engineering since the last 29 years, around 30 years. Bassam was even before me. So we tried 20 years back to make a society in Lebanon. We did not succeed due to different political polarization of ideas. We had to pick the people who really wanted to focus on biomedical engineering, on the career itself, on improvements of clinical engineering. We started a society called HTMA, and it is very successful. But the important thing to say about it, it includes clinical engineers, but also it includes everybody who works with technology. We have in this society radiologists, radiographers, nurses, physiotherapists, and it is so successful. And we have lots of activities, of course, not as much as IFMBE. No one can beat IFMBE with the activities, but compared to us in the region, we are active enough. And luckily, what made us, all of us, aligned towards improving the all activities, all work, all jobs that are related to technology, and preparing the platform for HTA, because we understand that we as clinical engineers, we're the basis of HTM, health technology management, but as well for the assessment of technology. And this takes us to the other wing, the work that we do for public here in Lebanon and in the Arab countries, because I personally volunteer with the Syndicate of Private Hospitals in Lebanon. And I'm also, as you can say, a collaborator or an expert with them. So we try to elevate the level of awareness regarding technology and studying everything related to technology with the Syndicate of Private Hospitals. It's a note to say that in Lebanon, we have more than 85% private hospitals, and the 15% governmental hospitals are relatively weaker. So on the ground, the private hospitals are more active. And we also helped with the Ministry of Health. I personally was a member of the group of 2 people to put the standards for the hospital architecture, for the facility design. So now we have a standard for every person who wants to build a new hospital or renovate to refer to. And that was a big work here in Lebanon. And
Riad, we've got just a little bit of time left, but I want to hear this great investment that you and colleagues have made in your own country. But now, as I mentioned, this is a model for many countries. What do you see happening around the MENA region that you'd like to share?
Yeah, sure. Happily, with the contacts that you have in IFMBE, we were able to contact several active clinical engineers in the Arab countries, in the MENA region, let's say, not only Arab countries, in the MENA region, Middle East, North Africa region, or EMRO region, Eastern Mediterranean region. We are working with a group of colleagues in Egypt, hopefully to prepare for a webinar. The webinar will be a a starting point for several Egyptian clinical engineers to meet on a regular basis and try to make a society. I see in a year time that we're going to see a society emerging from Egypt for clinical engineers, and hopefully this will elevate the awareness and the recognition of clinical engineers in Egypt. We're trying to do the same in Kuwait. I teach in a university in Kuwait. I have some contacts, but the work is still a bit lacking behind, but I can see it in 1 year's time. We're going to have another society over there. And I'm sure all other countries in the EMRO region will follow. And I think within a year or 2 years' time, we're going to see a very active region in clinical engineering.
Riad, this has been a great story, and the story is just some early chapters in it. I love the program that you moderated in July with several EMRO countries around COVID-19 response. So we're just so thankful for the work you're doing, and thank you for your time today.
Thank you, Tom. Thank you very much.
More to